Good evening and welcome to the third ELETS Healthcare Transformation Summit. We are now heading into a panel discussion on transforming the healthcare experience with conversational AI. We're delighted to welcome Mr. Tanjay Kapoor, Head of Marketing, Paras Hospitals. Welcome, sir. Ms. Sonam Sharma, Vice President Marketing in Core Group. Welcome, ma'am. Dr. Chandrika Kambam, Director, Clinical Services, HCG, Healthcare Global Enterprise Limited, who will be the session moderator. Welcome, ma'am. Mr.
Thank you.
Deepak Vashisht, Head Digital Marketing, Wockhardt Hospital. Welcome, sir. Mr. Ravindra Chand, Head Branding and Digital AMRI Group of Hospitals. Welcome, sir. And Mr. Srinivas B. Vijay VP Marketing, Gupshup. Welcome. I now hand over the session to Dr. Chandrika Kambam to take the discussion forward. Over to you, Dr. Chandrika.
Thank you, Garima. And thank you, ELETS, for organizing this session and also inviting me to chair this panel. And I'm indeed honored to be discussing this topic with the marketing heads across India. And this is the first time I think I'm the only doctor and surrounded by marketing heads in a panel discussion and on a topic which is technology, market, and healthcare put together. A conversational AI, when ELETS gave me this topic, I was quite intrigued and amazed at looking at the topic. Because I think nowadays, whenever you log into any website, I think the first thing that pops up is a chat box, which kind of asks you question how they can help, how they can guide you through the process of navigating through the website, and more so in healthcare industry. So these are the technology that people have developed, where with the understanding the text and the conversation, they kind of try to predict and also respond in an adaptive manner. So there are a lot of use cases for this, and in various industries are trying to adopt the same. So in the conversational AI, I think from technology point of view, if we are talking, there are three main ingredients to it. One is natural language processing, that is understanding the text or the voice that is typed or spoken, and the second is artificial intelligence, which helps to predict the data pattern and the communication. And lastly, the machine learning. The machine learning also helps in understanding and adopting to the user, so that the user experience is more precise and also connected to their needs. This is in general what I have about the conversation. Listen.
Hello, good evening, everyone. I hope you can
Good
hear
evening.
me.
Yes, yes.
So thank you, Dr. Chandrika, for putting me on and your wonderful introduction to the topic today. Let's dive right in and see how conversational AI can transform the healthcare experience for patients and doctors. I will touch upon key trends and how conversational AI can automate some processes with examples that I could gather. As we know, conversational AI is driving digital transformation in the healthcare industry, as it allows patients and the doctors to maintain a safer distance, automate processes, improve communication, respond faster, and also help optimize time. COVID has given a big boost to investment in this space, with estimates of over $2 billion in the next 5 years, which is amazing. A market size of over $18 billion and a year-on-year growth of 22% almost in the next 4 or 5 years. That's an amazing projection for this application. An application that is supposed to be smart, intelligent, something that can mimic doctors, schedule appointments, and automate many processes in a hospital. As you just mentioned, conversational AI is based on speech recognition, natural language processing, automated messaging, and machine learning, but it is much more intelligent than the chatbots we commonly encounter today. Just to understand a little better, a chatbot is based on scripted keywords And that is why we sometimes get frustrated using it, because the chatbot doesn't really understand the intent behind a question, and it is more like a FAQ chatbot. On the other hand, conversational AI understands the user's intent and learns over time to improve the experience. The trend is now to move beyond a basic FAQ chatbot to more complex applications, which are virtual customer assistant, which have got specialized dialogue management and robotic process automation for enterprise operations. The growth of conversational AI in healthcare is due to many features such as anonymity, the ability to monitor user behavior, personalization, real time interaction, and scalability. Therefore, it can be deployed in many applications. For example, symptom checking, patient history tracking, appointment booking, triaging patients, and many such more. Let's look at some of these in slightly more detail. So, this is Orbita Assist. This is a virtual bedside assistant that offers a common alerting platform for care teams. It is based on smart sensors and a voice based call bell. For example, at a hospital in Mumbai where I worked, we used a similar system on a pilot basis. This was deployed in some of the VIP and deluxe rooms, and the patient used to just, call out, for example, call nurse, switch on lights, close curtain, open curtain, and so on. And, everything was automated using sensors. So that's what we did at this large hospital in Mumbai. QDoc from Curel is a prescriptive chatbot for telemedicine. This mimics a doctor by asking intelligent questions, interpreting reports, and suggesting investigations. Lifelink Systems has a virtual waiting room solution. This was used by Banner Health US for appointment registration and guiding patients to the examination room, thereby skipping the waiting room in the hospital altogether. And this was a big move for them during COVID. It helped them a lot for better safety and social distancing. Now AI can also be used for pre-op counseling, counseling of patients who may be apprehensive of certain procedures such as cancer related diagnostics, colonoscopy, and so on. So Northwell Health, a hospital, used this successfully to reduce no-shows by more than 40%. Coming to home care, a very fast growing service in India, which has been estimated to reach about 3,200 billion rupees by 2026 with a 38% CAGR. We think that conversational AI can be used by hospitals to monitor and care for patients at home. AI can also be the first point of contact, where we have a talking or texting smart chatbot, first point of care. That's also possible. Even for urgent care, conversational AI can collect patient information and send to the doctor immediately and accurately. AI can also play an important role in patient counseling and offer emotional support. For example, Wobot helps cope with mental well-being using CBT techniques. We have triage chatbots, and Babylon Health is an example of such chatbots. It offers AI consultation based on medical history. Users voice their symptoms, and the chatbot suggests a course of action. Let's see now how conversational AI can automate processes and help patients, clinicians, hospitals, and payers. Patients can be provided personalized answers to queries. They can check for symptoms and get some idea of health issues. Conversational AI can automate appointment scheduling, pill reminders, collect patient data at check-in, and follow up post-discharge from hospitals. Now, this shows how WhatsApp can be used throughout a patient's journey to automate information flow over text. In one hospital that I worked in Hyderabad, we used this functionality in a limited manner for providing basic details such as emergency information, canteen, where to eat for the patient, contact numbers, OPD details, etc. And this resulted in a lot of frivolous calls to the call center getting routed through this application. Well, AI can also help clinicians by automating EHR using voice assistants and also in the OT to record notes, which is amazing actually. Automation of call centers is possible. Some of the mundane work done by call center agents, such as call summaries, can be automated. Providers have reported significant improvements in NPS, lead conversion, and cost reduction using this methodology. Coming to payers, some payers have automated routine transactions. For example, Bajaj Alliance uses Boeing chatbot to answer customer queries. ICICI Lombard has a chatbot called Maida that automates query management. HDFC Life uses Spock to respond to customer emails. Now, since we have limited time, I will quickly run through some chatbot applications which could be interesting. So, MyGov is a virtual assistant chatbot for real-time COVID-related updates. Introbot is a WhatsApp-based COVID helpline bot for critical medical resources. Visa chatbot not only provides mental health support, but its machine learning platform identifies potential health problems. Uper is a mood monitoring chatbot with personalized meditations. It can track your mood and monitor emotional health as well. Florence is a personal nurse chatbot. It reminds you to take your pills and also can track your health. One Remission. This is a cancer support chatbot. It is aimed to help cancer patients with relevant information when they need it. Cancer chatbot is one more such resource for cancer patients and their caregivers. Now, symptom assessment I find appears to be very popular in terms of usage of conversational AI. We have Healthily, an AI symptom checker. Ada Health, another one that intelligently monitors health data. Boy Health, this is a prescriptive chatbot. Symptomate, another symptom checker. Sensely, virtual assistant. And Giant, that sends data to doctors who provide diagnosis in real time. Now, a lot of what I just said may sound very futuristic or maybe impractical for our kind of country, given the wide diversity of patient demographics. Also in healthcare, it is often a life or death matter, and the stakes are very high, as we know. For example, a parent could be inquiring about the right treatment for her injured child, or someone might be in need of urgent emergency care for a stroke. In such high impact scenarios, chatbots will have to offer accurate information and guidance. Challenges will also emerge during implementation and integration with hospital systems. Every hospital has a different legacy HIS, most of the case, so integration is a challenge. Data security and privacy are concerns which are always there in a hospital setting. Patients across the country will have to get used to using and conversing with bots in their regional languages. Yet, all said and done, I'm very optimistic that there can be an effective working combination between the efficiency of AI and the personal touch of doctors and care workers. I think that can never be replaced. So I'm open to questions based on what we just
Yeah.
discussed.
Yeah, thank you, Mr. Kapoor. I think we'll take questions at the end. Let us get the views of all the panelists, and then we will kind of have last 5 minutes in case we have any questions. I
Perfect.
think that was a good overview by Mr. Kapoor on what conversational AIs are, and the advantages and the disadvantages, and what is happening around the world. Now, I like a famous adage goes: the internet has not changed the customer expectation, but it has empowered them. Customer today expect a world class experience even from the smallest of the organization. So that is what the internet and all this technology has done for us as we go forward. So now let us hear from Sonam, who's a vice president for marketing from Incor Group. What has been her experience in conversational AI in healthcare industry, and are there any specific areas that she can deep dive into to give us examples and tell us how this can be adopted in healthcare industry? Over to you, Sonam. You're on mute, Sonam.
Sorry, can you guys hear me now?
Yes, yes, we can.
Okay, thank you, Dr. Chandrika. Thank you, Mr. Kapoor. I think I'll begin with introducing myself. I had marketing for a group called Incor. Uh, the group itself is in multiple industries, and this topic therefore is extremely interesting for me because I've started seeing the use of conversational AI across industries. Healthcare, of course, being some an industry that started using it in a more advanced fashion. I was going to explain the usage of AI in healthcare, but I think Mr. Kapoor's taken us through. I think largely taken us through the complete spectrum of AI in healthcare. Um, as we're aware, I think healthcare delivery model has seen a rapid change over the last decade. With the onset of COVID, of course, this has speeded up the process. We've started using digital healthcare a lot more. The consumption for digital healthcare has gone up dramatically in the last 2 years. Whether it's NLP, like you began with saying, whether it's natural learning language process, whether it's robotic process automation, whether it's personal health wearables, all of this has changed operational healthcare for the better. And I'd like to just kind of highlight maybe the top two or three operational aspects where I see a huge difference, not just in terms of the patient, but also benefits from the hospital point of view. Of course, with the use of AI, we've accelerated our clinical data recording processes. We have also seen a lot of accuracy in clinical predictions. There has also been a huge step forward in terms of using more sophisticated surgical devices, whether it's robotic or robotic assisted surgeries. That's something that we've also seen. Omni Hospitals, which is Incore's healthcare brand, has started seeing. We've recently acquired a robotic surgery equipment for orthopedics. um, Another area I feel, apart from the technical aspect of AI, that has really helped both the patient and the hospitals is the kind of grassroots penetration we've achieved uh, after AI. So telemedicine has helped us reach the rural population. And I would say this from a personal, or rather, from my hospital point of view, which is focused at catering the district or rural population. We've seen penetration like never before. Uh, so while it makes healthcare a lot more accessible for people, it also expands our own geographies. So technically, if you see from an OPD point of view, our OPDs are no more limited to just the lobbies of our hospital. The world is our oyster now. The whole OPD is a universe by itself. Whether it's an audio video consultation, whether it's our websites that are now, if you see, most websites and hospitals are using these active AI chatbots. um, a really cool example that I would like to share from it's something that we've recently implemented, is a bot that we've developed, and we're in the implementation process for patient post-op follow-up. So this used to be a manual process where all of our follow-ups were done by an individual sitting behind a call center, calling our patients, checking, asking for feedback as to what their experience with the hospitals was, or what medical intervention they might possibly need now. But this has been automated, and today there's a bot that reaches out to our patients. It is fed with questions that are obviously pre. I mean, there's a vast research as to various procedures, and then at predetermined intervals, this bot reaches out to all of our patients, asks very procedure related questions, asks for the patient's current health status, collects all of that data. It's submitted to our healthcare team, our medical team. So if you're technically looking at a hip replacement patient, there is a 7-day follow-up program, and it goes on for a few months till we're happy. And it helps us in two ways, of course. Uh, and I'd like to add that if there's an emergency, it alerts the doctors immediately, saying there's an immediate intervention required, which is again something that's been not a proactive approach from hospitals. where in the past the patient had to reach out to the hospital saying, hey, you know what, I need help. This has now become a proactive sort of process from our end. It helps us in multiple ways, of course. It helps. This bot acts like a personal assistant for our clinical team, so the doctors are happy. It improves the patient post-discharge experience. Patients are happy, and I think the most important of it all, it really improves our Google ratings. So there is so much that can be done with AI, and I don't really have a presentation, but looking at it from a more marketing point of view, also it's really changed the way we've been functioning. With the use of AI today, we're able to make, or rather, I would say, segment our audience. We in the past, especially in healthcare. I mean, I work in multiple industries, but I've seen this most largely in healthcare, where a lot of marketing efforts are targeted towards the masses, and we don't really know who we're reaching out to. But with new with this technology, we're able to segment our audience basis, the specialty that they might be interested in, what stage of procedure what stage of disease they might be in, what geography they're in, what language they speak. So we're able to segment our audience pretty very well, very well. That helps us design more targeted communication to these patients. So you're not sending out irrelevant ads, which I think is a big hassle today. If you see, a lot of us get SMSs from all sorts of hospitals, and it's for diseases that we're not even interested in. It helps us reduce wastage. The third piece, of course, is that it helps us send out automated communication, which reduces our workload dramatically. A lot of, and I know I'm talking from a more marketing operations point of view, but it has been a big issue, where we have people who are sitting and drafting SMSs. Those kind of things have dramatically gone down with the use of AI. And then of course there are the more there are clinical sort of advantages, which Mr. Kapoor covered very very well. Whether it's precision medicine, whether it's improving patient care, whether it's the use of virtual healthcare assistance. Overall, I think the face of healthcare is changing dramatically, and I think 22 is the year where we'll kind of see the actual implementation of AI, and what kind of impact it can have. um, I think yes, a lot of other countries are doing a lot of stuff, but I think India is also right up there. We are now seeing the future come into play. I I think that's it from me from an AI and healthcare point of view.
Yeah, that's very well put, Sonam. I think between Mr. Kapoor and Sonam, Mr. Kapoor covered AI, which he has personally has some experience in, like an Alexa type of a AI, where you give a command and it helps to execute few things like call a nurse or call ask for food or such type of a command to what Sonam speaks about post-op follow-up, and the good thing is it also alerts the clinician and identifies the red flags and alerts the clinician. I think that's a wonderful initiative, and rightly said, segmenting the patients and targeted messaging so that people are not bombarded with unnecessary and irrelevant clinical information. And information overload today is most important aspect that we have to keep in mind when we are looking at marketing. And definitely, in today's world, the customer experience matters more than ever, and outpacing product and pricing as the single biggest and brand differentiator. According to a Forbes, 82% of customers will stop doing business with a company after a bad customer experience, and roughly 80% will tell others about their experience. So, with this, keeping these statistics in mind, and also what's happening, how things are changing in the marketing world, let me ask Deepak from his experience, how is conversational AI or AI in general is helping them, and especially during the COVID period, what type of use they had from these technology devices at their disposal. Over to you, Deepak.
Thank you so much, Dr. Chandrika and Elets for having me on this panel discussion. Conversational AI, as we all know, that as Dr. Kapoor mentioned in his presentation, that the most common tool, which is the chatbot, and some of the mobile application that most commonly majority of the companies, the healthcare organizations, especially the hospitals, are nowadays using. Uh, is something that is actually saving a lot of time in responding to its patients. More importantly, the data that we feed on to these chatbots and the applications, they are fed with pre-scripted responses to the patients, not for the first level of engagement, but for the post-op engagements as well. As Ms. Sonam mentioned in her description, that the kind of application that they are working on, similar level of application is something, or a bot is one of the things that even our hospital is working on, and most probably we are targeting to launch the same in future, which will basically help our OPD patients as well as both IPD patients to save a lot of time, for answering all their queries. Now, to give you a few of the examples, as we know that the AI in India is at a very nascent stage as of now, but there are still some of very good AI-enabled technology which is currently being used in in forms of these chatbots implemented on the website, or the mobile applications developed. Now, to give you an example, the AI-enabled conversational mobile application, which are developed and are being used by some of the uh, healthcare organizations across the world, uh, is not just to simply book an appointment. As we all know, that virtual consultation during the COVID time became the first thing to be used by almost every patient around the country or around the world. In our particular case, even as we are spread across India, and all our hospitals get multiple patients from not just the main city but from the periphery as well. So this helped us to cater even the tier 3 cities patients as well. Now, the application that we were using to basically help our patients to consult the doctors were not just the non-COVID patients. As our hospital was purely, we converted all our hospitals into a COVID facility, but we had another set of non-COVID patients as well to take care of. So this particular online consultation platform helped us to take care of both set of patients, the COVID patients as well as the non-COVID patients, to treat their ailments or to address their queries. Now, about apart from this online consultation, uh, it has not practically helped only the patients. It has also helped our doctors who are practically in the first point of contact using these applications to respond much more faster. So the chatbot that we have implemented, that we practically made more efficient on our website, considering all the factors of COVID which we were put in. We made our chatbot more efficient, not just to offer basic information regarding the doctors or some information about the hospital. We also made the chatbot more efficient in terms of capturing as much data as possible of a patient, so that basis that our backend team could filter out the different various needs of various class of patients, and on the basis of that the chatbot was again fed with the different responses to be shared with the various class of patients. Now, these some of the examples I would like to share with you, with respect to the solutions that our chatbot is offering, is not just booking an appointment, but also booking home sample collection, booking an emergency or a normal pickup and drop ambulance service. And also the chatbot was fed with a lot of educational material in form of text as well as video library, which was very much important during the COVID time for everyone to understand, as everyone was scared of how they should be taking care of themselves and everyone around them during the COVID time. So a lot of data is being captured through these chatbots and mobile application, as Mr. Kapoor mentioned in his study, that a lot of applications are now capturing various types of data, and basis that they are reacting to different emotions or feedbacks of users who are using these applications, and guiding them and suggesting them different kind of solutions to their health needs. Now, what other practically technological solution that we are implementing, trying to develop and implement in our conversational AI bot, is that wherein we will ask all the basic and important vitals of all the patients using these apps. Basis that we our doctors will be made enable to practically filter out necessary basic treatment for these patients, as well as further these chatbots or the application will be able to help our patients to book their regular routine health checkups, as well as the bot will be able to help these patients to remind them about their medication, and many more solutions. Now, coming back to one of the things which I want to explain a little further, which is the online consultation platform. This platform has not enabled only to respond faster, but also to maintain social distancing. But the bot or the application that we have used, it helps the doctor and the patient to access all medical data that was earlier being used conventionally on a handwritten notes. Now all those have been converted into digital prescription notes. Those notes can be used by both the doctor as well as the patients at any point of time, and basis those notes, the bot is again prompting the patient to either go for a medication as the schedule given by the doctor, or going for a health checkup as prescribed by the doctor. So that is one thing. Now, another thing which I want to highlight, that the chatbot aimed to cater to the healthcare center's need, could actually let patients book their appointment within a minute without getting in touch with a receptionist or a human agent. Those things have also made chatbots medical center to deal with unlimited user queries. Earlier, our staff was able to handle only a limited number of queries, as they had their fixed working hours. Now, due to now with the support of this 24/7 technological tools, we are able to cater unlimited number of queries, and along with the filtered data that is being used for further decision making. So once the data is captured, it helps our backend mechanism to filter out various needs for which these different class of patients are contacting our hospitals. And on the basis of those data, we are able to curate specialized healthcare offers or services to be given to these patients. So which is actually the technology is helping healthcare workers to identify symptoms promptly and categorize the patients who need immediate attention from the less critical patients. So
Yes.
basis that our backend team who is making these specialized plans to be offered to these patients, they are able to plan everything more efficiently now than ever.
Yeah. Very good. Thank you, Deepak. I think that was quite a bit of an activity that you have tried out. Starting from telemedicine for COVID to home care, home sample booking, and ambulance booking. That I think that's an excellent takeaway point for our audience. Along with that, of course, a patient education material. And another thing that I really liked is that post consultation, what are the actions that the patient has to do? And the conversational AI or the chat bot is helping them through that process of booking appointment, etc. That I think is also a wonderful example of usage of technology in an appropriate manner. Definitely, all these are futuristic, and from a website which used to be very one way, just giving the information to the patients or to the consumer. Now the website and the chatbot have become interactive, and they are trying to engage with people, engage to find out what their needs are, and engage to help them through the process. I think that is definitely a future, and that is how it is transforming the healthcare delivery, because it is taking away burden from the front office quite a bit, and helping people to be more self reliant, self service type of a model is developing, and this definitely helps us to take the healthcare delivery to the next level. And during the COVID period, when a lot of them were sick, and I'm sure these technologies really came in hand. With that, I think it is not. I think that, as Dr. Kapoor said, there are a lot of challenges in conversational AI in healthcare. It is not as easy and as simple, because of the medical terminologies that are involved, and the way people pronounce different ailment, and lot of technological help, medical help is also required from properly qualified people to help put this database together, so that the conversational AI can help us. So moving on, let us talk to Mr. Ravindra, who is head of branding and digital from AMRI group of hospitals, to understand how this is helping in his sales and marketing activity, and how this is helping customer satisfaction, and how they have been able to use this in their hospital. Over to you, Ravindra.
Uh, Good evening, Dr. Chandrika. So, thank you for the introduction. I'll quickly move over to. So, there are two areas I'll be covering today. One is, like you mentioned, how conversation, not just a chatbot, but conversational AI-based chatbot, uh, is helping and can help in sales and marketing, whether it's a revenue generation perspective. And second aspect we'll be touching upon would be how this conversational AI can help improve customer satisfaction or customer experience, to be more precise. But before I get on to that part, I'll just do a brief context setting. So, see, chatbot have been in existence for quite a while, and so today what we are talking about, the conversational AI, is a complete evolution from what it was few years back. Um, but all the marketers who are there on this panel would agree that today a marketer's role has evolved drastically over past decade. Today a marketer has to don multiple hats. I mean, while the creative aspect of marketing will always be the guiding factor, but today a marketer has to have a deep understanding of technology and data analytics, because without these, any marketing campaign or strategy is bound to yield suboptimal results. And from my experience, a few years ago, when we tried to implement a chatbot for another healthcare company, it was a frustrating experience, because at that point, chatbot was more of a FAQ based bot, which could only answer a preset or predefined queries. And in a healthcare space, which is very complex, where user queries would be at times ambiguous or very vast, so that's where the chatbot would fail. So it was not helping at all in terms of automation or getting the relevant information to the user. And so that's where I think the conversation AI, like I said earlier, has with this evolution provides the uh, right solution. uh, I mean, as you would agree that with Google, Apple, and Amazon fueling user expectation in terms of hyper personalized experiences, AI based chatbots, with their ability to comprehend user intent and then offer contextual responses by actually predicting and accurately identifying what user wants, and then basis that it formulates a very personalized and specific response instead of robotic responses. And not just that, with each interaction it learns and preserves that information. So that's where the real which is what that's where the real power of AI based conversation bot help lies. uh, so uh, from our my experience now, I realize that in today's scenario, whether it's healthcare or any other domain, a marketer has to not just learn but also have understanding of some key technology aspects, data lakes, your APIs. So those are very important. That's where the marketing and IT sync has to be in perfect sync, because to yields perfect outcomes. Now, I'll quickly go over to some use cases uh, on sales and marketing and from customer experience perspective. So, in healthcare space, there are healthcare organizations which have been existing for over 2 decades with multiple units operating over different geographies. And many a times, these hospitals or healthcare companies are still using legacy systems where data resides in HIS, LIS, and CRM. And most of this data in silos and data formats are different. So something like data lakes, where it helps, wherein it data lake would be integrating, fetching data from different legacy systems, cleansing the data, segmenting it basis the patient history and uh, patient markers. And once the cleansed data is there, resides in data lake system, then this can be fed into multiple applications, whether it's your mobile app or your website or your booking engine. And then there are multiple use cases where this can be utilized. So now I'll quickly move over to how in sales and marketing AI based conversational based AI can help. So one area where I see and we have used is conversational landing pages. So healthcare space, we use Google search ads extensively to generate qualified leads, highly qualified leads, where the user have very high intent of conversion. But if you look at it, most of the landing pages, once your ad shows to a user on Google searches, they click on the ad. What do they see on the landing page? It's a standard. You have a banner, you have a lead capture form, and then information about your services and book an appointment. Uh, this is where the conversational landing pages can completely change experience of a user and generate a better or more qualified leads into your system. So a conversation landing pages would be wherein instead the moment a user clicks on a Google search ad, instead of leading it to your conventional landing page, it opens a chat on user's device, wherein basis, for example, uh, a user was searching for bone marrow transplant cost, and then once he sees your ad, he clicks on the ad. Instead of diverting the user to a standard landing page, it opens a chat wherein some pre-fed questions, but at the same time, um, uh, uh, the user queries based on the past experience responses, whatever input user has regarding bone marrow transplant cost or the complications. So all that information is being fetched, and user is consuming that information in interactive fashion, rather than it being a one-way conversation. So at the end of this, the lead that flows into your system through these conversation landing pages would be more qualified than something leads which flows through your generic landing pages. Now, other areas where these conversational AI can is helping immensely would be your Google business messages, because every healthcare company today would have even if it's operating from multiple units, would have their official business listings on Google businesses, and from those business listings, uh, each hospital generates a lot of inbound calls. Now, since Google also offers a feature of chat, wherein instead of user clicking on the call icon and landing to the number leading the user to the call center of the hospital, user has an option to initiate a chat. Now, instead of conventional chat, wherein someone at the end of the hospital end has to respond to those chat, which becomes very cumbersome and not feasible, a conversational AI can help not just automate the entire experience, but make the entire experience more personalized for the user who is interacting with the hospital. And similar use cases are your Facebook Messenger and website as well. Now I'll move to the customer satisfaction or customer experience part. So this is where it gets more interesting, and this is where the conversational based AI based chatbot can is playing and can play a huge role. But this at this for customer experience part and the customer engagement part. When I say customer engagement, I mean engaging with the patients who have already been into your system, done consultation, or has have undergone some procedures in the past, engaging with those users to ensure that we get a repeat business. And this requires very deep integration with your HIS and LIS and CRM, and which will ultimately enable hyper personalized experience basis patients biomarkers like blood sugar and other attributes. So some use cases could be from your HIS. The system fetches data like name, phone number, email ID, age, gender, pin codes, last bill date or last visit date, which specialty was consulted, biomarkers like blood sugar levels, which doctor consulted, length of stay, payer type, insurance, TPA, corporate, cash, and discharge mode. Discharge mode because we don't want to send out communication to people who have already deceased or who are not eligible for our communication. So once all this data is fed into a data lake and then cleansed, segmented, then the same data can be used to these attributes that I just talked about can be used to send targeted communication, customer nudges, and we can design hyper personalized interaction with the users. So this is the one area where it can offer immense. This has immense potential, and it can generate uh, it can generate a very good customer experience and resulting in repeat business for any healthcare company.
Yeah.
Uh,
Thank you.
to,
Yeah.
yeah, just to end our my part of the discussion, I would highlight that some key points one any business or any healthcare company we need to keep in mind when we are trying to zero in on an AI-based chatbot is what NLP standard are is the vendor or agency following, whether it's IBM Watson, Google Dialogflow, Amazon Alex, and then what are the scaling capabilities? Can it be extended to voice or multilingual, or in fact even local dialects? And does the solution offer something like disambiguation? When I say disambiguation, I mean if the user's query is very ambiguous, can the system actually understand the intent and then provide the right solution? So these are the
Yeah.
few things that one should keep in mind when trying to zero in on a solution for your organization.
Very well put, Ravindra, and I think very well said. I think Ravindra's point stressing on holistic approach of IT solutions in a hospital, where every solution that your bot are talking to each other, whether it is EMR, whether it is HI system, whether it is CRM system, whether it is LIS. Is very important to see the ultimate effect of the conversational AI for the patients. So we would now ask. I would now ask Mr. Srinivas, who is VP Marketing Gupshup, to deep dive a little bit more into patient experience of AI, and how do people perceive that being in healthcare and being in healthcare management, being a doctor and marketing and looking at healthcare as an industry, we are focused and from our point of view that we feel that this is helping. But what is your thoughts and ideas on how this is helping the patients, because they are the end users at the end of the day, and how is it transforming our whole healthcare sector? Can we hear a few words from you, Mr. Srinivas?
Sure. Thank you, Dr. Chandrika. And in fact, I must say that I've learned a tremendous amount from my marketing colleagues in terms of their experiences and also the technology that they've been implementing in their hospitals. So I think we believe, like Gupshup as a company, we believe that conversations are going to be the default mode of engagement between a business and its consumers in general. And we see that this is a trend that is sort of coming in across all verticals, and healthcare is definitely one of them. And the reason for that is, we always believe that consumers are a few years ahead of businesses. So we feel that in the last 10 years, the adoption of messaging apps and messaging technology has taken up, has really increased exponentially. So if you look at Facebook Messenger and then WhatsApp, Instagram, and this whole like Telegram, Signal, and this whole family of apps. Now, what the pandemic has also done is that it has increased the usage of these apps to such an extent that they have also provided much needed succor and connect for people who have been isolating or not been able to meet and travel and so on and so forth. So what has happened because of that is, earlier when you would look at things like a website or a mobile app as being a default mode of digital connect, like as a patient, for example, I would go to a website of a hospital, or I would go to maybe an app if the hospital has an app. I would look to have a more intimate one-on-one conversation with the hospital or a clinic or whichever healthcare facility on my messaging app, because I'm already on it and I'm having all my conversations on it. I mean, as a panel, we also connected on a WhatsApp group, we exchanged ideas and so on and so forth. So it's such a very big part of our life. So this is one mega trend which is happening across all industries. Now, with healthcare, more specifically to healthcare, I feel that it is an area where the patient experience is ripe for this technology. And the reason for that is especially in countries like India, where the doctor to patient ratio is so low that it is important for the technological infusion to sort of try to bridge that gap. But at the same time, given that healthcare is such an important part, so the cost of going wrong is very high as compared to, let's say, in an e-commerce situation. Let's say you recommended the wrong product. No one is going to get hurt because of that. But in a healthcare situation, if let's say you recommended a wrong course of action in some way, then it might lead to other issues. So it is an area where an additional amount of care has to be taken to ensure that we are able to create these conversational AI powered workflows on messaging apps. So that is where healthcare is today. And I think, of course, healthcare is a very broad and deep ecosystem. So you have drug research, uh, pharmaceuticals, you have hospitals, clinics, and also the intermediaries between them. But Gupshup is focused a lot on improving the patient experience for healthcare brands. So what we try to do is that we take healthcare brands and get them to converse one-on-one with their patients or the patient ecosystem on messaging apps, like specifically WhatsApp, because it's a more intimate one-on-one conversation. So some of the areas where we've seen a huge amount of adoption from hospitals and clinics is, one is education. So like for example, we are partnering with one of the pharmaceutical companies who's using one of the bots that we've built to educate patients proactively on how to manage hypertension. So the bot has various Q and A's, and the patient and the person can actually ask more questions, more complex questions, and then the bot will try and find answers and from credible third party sources to educate the person. And in case they're looking for recommendations on who can I see and all that, there are links to for them to go to hospitals or aggregators. The second kind of use case is a clinic that specializes in skincare. So for them, we built a virtual assistant on WhatsApp that has a sort of a personality and a name, and is trying to understand from the patient, like what is the kind of skin that they have, uh, and how do they determine where to fit them in, like what is the, like is it a dry skin, is it an oily skin, do you have an acne problem, how to identify what you have, and collect all the information and then recommend the next step that the person needs to take. So a lot of this, like you were mentioning, Dr. Chandrika, is taking away the some amount of load from the let's say the outpatient department at least. Then for a hospital, one of the in fact I think the largest hospital in Bangalore, we are providing a bot that manages the entire hospital interaction for a patient. So, for example, you can book a doctor's appointment, you can book a try and find a bed. In fact, this bot was used heavily during the second wave of COVID, where unfortunately a lot of people were looking for oxygen, they were looking for beds. So this bot came in handy because the hospital could not scale staff beyond a point to answer the phone all the time. So the bot was very useful in sort of answering a lot of questions for patients, and continues to be used to this day. So these are some of the ways where a hospital can actually, you can think of it like conversational AI can create a personal, I don't want, I will not use the term doctor, but a personal healthcare assistant to every single patient out there, irrespective of what they can afford, irrespective of where they are. They can at least get some of their queries answered. They can at least get some of the services of the hospital or information on the services, or they can book and register some of the services. And at the same time, the hospital can also use that to stay in touch with them and continue the relationship, because as compared to every other industry, healthcare is very different in that there is a lot of empathy that has to be built into uh, the whole ecosystem, and conversational AI also has to bring in that empathy factor, because you don't care really if a retail store doesn't check in on you, or it doesn't communicate with you properly, but you would care if your doctor or your hospital or your clinic uh, or your healthcare physician is checking in on you and with care and concern. So building that empathy into the conversations is a very important thing that we follow at Gupshup, and something that the industry is also asking us to do. So net, I would say that it's a very, very fundamental shift that is taking place in healthcare with respect to conversational AI, as it is in the other industries. But here one has to be a little careful, because the core service, that is, it's still provided by the doctors. So where we are trying to optimize is the patient experience, the patient facility, the patient services across the life cycle of the patient. So yeah.
Okay. Yes, that's yeah, quite amazing. So there's one question, Srinivas, for you, saying that how are you catering to tier two and tier three population? I think that's a very interesting question. We are so much focused on technology and metros. How are things transforming in our tier two, tier three cities?
No, that's a great question, and I think the best way to reach out to the population in tier two, tier three cities is to use whatever technology that they are familiar with, without them having to, like, imagine somebody who's living in a rural part of India trying to figure out their way through a website. Even though today I will admit that a lot of our population is getting a lot more digitally savvy, but it's not universally the truth. So which is why the importance of using messaging apps that they're already really familiar with really helps. So we are working with a lot of these national uh, hospital chains that have presence in both tier one and in smaller cities and towns. But the core answer to the question is, what is that last mile, that the technology in the last mile that connects the patient to the healthcare system, that is the most important. And I believe that last mile technology has to be the messaging app, because that is something that they are the most familiar with.
Okay, thank you very much. And I think this was a wonderful session. We covered quite a bit on the topic conversational AI for our viewers and for the delegates who are listening to this conversation. The topic was how conversational AI can transform healthcare delivery and take it to the next level. We kind of dwelled on a lot of use cases, which is very important because there is no point in talking theory. So our panelists today gave you practical examples of how they have used and implemented conversational AI in the patient journey. The take-home message for all of you would be map your patient journey. Map your patient journey from before coming to the hospital to going back home, and look at various touch points that you can engage patients with by using conversational AI. It could be from booking appointments, booking a home sample collection, ambulance call, symptom checker, to staying in the hospital, like how to order my coffee or how to call my nurse. to then going back home, what are the questions that I can engage my patient with, so that I identify any significant problem to the patient, or I cater to my patient's needs post going away from the hospital for various aspects of care. So this, I think, is covered by all our panelists wonderfully, and we talked about the challenges that how healthcare is different from other industry. Here precision is very important. We should not give wrong advice. I think do no harm, I think is very important in healthcare. Even if you are not doing something good for a person, we should not be doing that will harm people. So we have to take extra care when we are developing these technologies and making sure that they work all the time and in an appropriate manner. And we also looked at the importance of infrastructure, IT infrastructure. In every conference of mine, I have stressed the fact that we talk about transformation, we talk about technology, but we don't invest in good infrastructure for IT, which is very, very important to take this whole technology piece to the next level. Infrastructure is very important. All the systems have to speak together and speak with each other. Only then the impact of this conversational AI or any other such technology can be seen to the full extent. If there are any more questions to our panelists, please feel free to post them. We can send it out to them and get you the reply. And if there are any use cases that anybody would like to share, please do share with our conference organizers email ID, and we would love to hear that. And at some point, I think a survey from the consumers saying that how do they feel interacting with conversational AI and any such tool on the website or hospital application system will be something that we should look forward to at some point. If any of you do share it with me. I'll be very happy to read and see how this how this actually impacts people. With that, we'll come to end of this session, and I thank all my panelists for wonderful insights, and also the practical insights, which are very important for us to take home. Thank you.
Thank you. Thank you so much,
Thank you,
Dr.
everyone.
Dr. Chandrika, for your wonderful moderation. And I thank all the panelists for these pointed insights shared today on the various aspects of conversational AI and the revolutionary changes being brought in with players like Gupshup, who are transforming the healthcare delivery in the country. So thank you, everyone. We would like to inform the esteemed gathering about the two of our upcoming events: the 4th Diagnostic Leadership Summit on 22nd and the 23rd of March this year, and the 2nd Pharma Leadership Summit on the 26th and the 27th of April. I once again extend a warm gratitude to all our esteemed panelists here for their time and presence, and please accept a small token of gratitude from our end through the certificates that we present to Mr. Tanjay Kapoor for his presence and his wonderful insights. Ms. Sonam Sharma, Dr. Chandrika Kambam for moderating this wonderful session that we've had today. Ms. Sonam Sharma, Vice President, Marketing, Incor Group. Thank you so much, ma'am, for being here amongst us. Mr. Deepak Vashisht, thank you so much, sir. It was wonderful listening to you. Mr. Srinivas B. Vijayaraghavan, VP Marketing, Gupshup. Thank you so much, sir. It was wonderful to hear again about Gupshup and the initiatives being planned out. And Mr. Ravindra Chand, Head Branding and Digital MRI Group of Hospitals, for your pointed insights. Thank you, everyone. It was wonderful listening to all of you. Thank you so much.
Thank you.
Thank you. Thank you.
Thank you.
Thank you.